So, today we're diving into Chapter 8, the respiratory system, which is the last body system we will cover in week 2. So, once again, our goals for the chapter are threefold. First, understand what the system does, so the terms make physiological sense. Second, learn the specific anatomical terms. Finally, we'll look at the vocabulary surrounding pathophysiology, pathology, diagnostics, and therapeutics. So let's look at the map of our airways. Note the division between the upper respiratory tract, everything from the larynx up, and the lower respiratory tract, trachea down into the lungs. Take a close look at the microscopic view on the right. That's the alveoli. If the trachea is the trunk of the tree, the bronchi are the branches, the bronchioles are the twigs, and the alveoli are the leaves where the real work happens. Keep these structures in mind because every single one of them has corresponding combining forms, which we will discuss. So this is just another picture of the lungs. So we've got respiratory function here. And so ventilation and respiration, let's talk about those. Ventilation is mechanical, the literal physical movement of air in and out, inspiration and exhalation. Respiration is biochemical, the actual exchange of O2 and CO2 across the alveoli membrane. Notice the pH range under acid-base balance, 7.35 to 7.45. The lungs control this by dumping or retaining CO2, which is an acid. If a patient isn't breathing well, their pH drops, leading to respiratory acidosis. And that's probably the most I'll get into that. So, why do we care about splitting the system into upper and lower tracts? Because it dictates clinical specialization and coding. An upper respiratory tract infection, like the common cold, stays outside the thorax and focuses on warming and filtering. A lower respiratory tract issue involves structures inside the thoracic cage and threatens gas exchange. If you see the suffix itis, which means inflammation and possibly infection, attached to an upper respiratory tract versus a lower respiratory tract structure, the level of clinical urgency changes significantly. So we'll break down the word parts. Nares are your nostrils. Septum comes from Latin word for wall or partition. A deviated septum is a wall that is leaning too far to one side. Paranasal, when you break that down, it's para, which means beside or near, naso, which means nose, and al means pertaining to. So pertaining to spaces near the nose. Eustachian tube links the middle ear to the nasopharynx. This is why a severe upper respiratory infection can easily turn into an earache. The anatomy provides a physical highway for bacteria. So when we look at the epiglottis, the prefix epi means upon or above. The glottis is the vocal apparatus. So the epiglottis sits right upon the opening. It acts as a lid. When you swallow food, it covers the airway so food enters the esophagus, the digestive tube, rather than the larynx, the respiratory tube. If the epiglottis fails, the patient aspirates, meaning food or fluid enters the lungs. So, bronchi versus bronchioles, the suffix ole means small or smaller. Therefore, a bronchiole is literally a little bronchus. So phrenic nerve, the root phren or phreno is unique because it can mean mind, like in schizophrenia, but historically it also refers to the diaphragm because ancient philosophers believed the seat of the soul and mind rested near the diaphragm. In respiratory medicine, phrenic always means pertaining to the diaphragm. If the phrenic nerve is severed, the diaphragm stops moving and the patient cannot breathe on their own. So here is a knowledge check. So I don't know how you're, if you are making flashcards and you're writing them out, that might be a helpful way to learn some of these terms. Notice we have two roots for nose: naso, Latin, and rhino, Greek. You'll see nasal spray, but a plastic surgeon performs a rhinoplasty. They both mean nose. Look at the suffix pnea, nia, meaning breathing. If I put a without in front of it, we get apnea, not breathing. If I put difficult in front of it, we have dyspnea, difficult breathing. So if we look at pneumo and pulmo, both mean lung. A pulmonologist treats the lungs, while a patient with a lung infection has pneumonia. Note the pneumo can mean air. A pneumothorax is air trapped in the chest cavity. Spiro means to breathe. An instrument that measures your breathing capacity is a spirometer. Time for a brain break. Now we're moving on to diseases and disorders. So, itis means inflammation. You will see this throughout the disorders and diseases. So, rhinitis, sinusitis, pharyngitis, and laryngitis are just inflammations of the nose, sinuses, throat, and voice box, respectively. So, rhea means flow or discharge. Rhinorrhea is literally nose flow, the clinical term for a runny nose. If a patient tells you their nose won't stop running, you document as rhinorrhea. Now we're going to move to the lower tract. Let's dissect atelectasis. Atel means incomplete, and ectasis means expansion or dilation. So atelectasis translates to incomplete expansion, which is exactly what a collapsed lung or alveolus is. Bronchiectasis, which is bronchi, airways, plus ectasis, stretching or widening. This is an abnormal permanent widening of the airways that traps mucus. This sometimes happens with COPD. So we mentioned pneumo, which means lungs. Pneumonia is specifically an infection filling the alveoli with fluid or pus. Pneumonitis, on the other hand, uses the itis suffix and is a broader term for lung tissue inflammation, frequently caused by non infectious hazards like chemical fumes or radiation exposure. SARS is an abbreviation for severe acute respiratory syndrome. So let's decode pneumocanosis, which looks intimidating, but let's break it down. Pneumo, meaning lung, coni, which means dust, and osis means abnormal condition. When we put it all together, it's an abnormal condition of dust in the lungs. If the specific dust is silica, we call it silicosis. This is common in miners, construction workers, or sandblasters. Let's look at pulmonary edema versus pulmonary embolism. And edema means swelling or fluid accumulation. Pulmonary edema is fluid drowning the air sacs, usually due to back pressure from a failing heart. Embolism means an obstruction or plug. A pulmonary embolism is a literal physical blockage, usually a blood clot that traveled from the deep veins of the leg straight into the pulmonary artery, shutting down blood flow. So let's look at the pronunciation with the one letter difference changes. Phonia refers to voice or sound. Think of a phone. Aphonia is no voice, hoarseness, or whispering. Phasia refers to speech or language, processing in the brain. Aphasia is a neurological brain issue, like after a stroke, where the patient cannot physically formulate or understand words, even though their vocal cords work perfectly. Here's a knowledge check. And now we're going to get on to diagnostics and interventions. So, the pulmonologist, let's break this down. Pulmon, which is lung, and ologist, or that's a specialist. And when we look at otolaryngologist, let's build it. Auto means ear, rhino means nose, laryngo means throat, and ologist means specialist. They're commonly called an ENT doctor, and they cover all three areas of specialty. A pneumocentesis, pneumo means lung or air, and the suffix centesis means surgical puncture to withdraw fluid. So this is inserting a needle into the lung space to draw out fluid or air for testing or to relieve pressure. Also note the sputum. If it isn't just saliva from the mouth, it is mucus specifically coughed up from the lower respiratory tract used for lab cultures. SOB is an abbreviation for shortness of breath and is considered a symptom. Bronchography is broncho, which is bronchi, plus graphy, which is the process of recording. So it's a specialized x-ray examination of the bronchi after injecting a contrast dye into the airways. When we look at ectomy, which means surgical removal, a lobectomy is the removal of a lobe of the lung. Be clear that the right lung has 3 lobes and the left has 2. A pneumonectomy is the removal of the entire lung. Pay close attention to these suffixes. So missing one letter like an E versus like if you take the E off the ectomy, it becomes otomy, which is cutting into, can completely alter the surgical meaning. Let's look at the prefix anti, meaning against. An antitussive works against a cough. Tussis is Latin for cough. A bronchodilator, which is broncho, airway, and dilator, which is to widen or open. These medications relax the smooth muscle layers around the bronchi to open up a clamped down airway during an asthma attack. They're very common rescue inhaler. Here is your last knowledge check. And we are at the end. Make sure to complete your Chapter 8 reinforcement activities and definitely reach out to me ASAP if you have any questions or concerns.